Yes, my name is Anneke denHollander. I work at the Radboud University Medical Center in Nijmegen, the Netherlands.
What did you present here at ARVO this year?
So I'm presenting in a special interest group meeting on fluid biomarkers. And the work I will be presenting is on complement measurements in age-related macular degeneration.
What were your findings?
So what we describe is several aspects in looking at complement measurements in blood samples of patients with AMD, where we see that there's a higher activity of the complement system in AMD patients compared to controls. And we're diving a bit deeper into that to see if that's also, for example, correlated with genotypes, so the genetic makeup. And what we see is that, for example, a very new finding is that some carriers of particular variants at the complement factor H locus have higher levels of factor H-related 4 protein, which is a regulator of the complement system that has not been studied much. But from our data, we see that it actually can compete with complement factor H in degrading C3b. So one of the aspects is the complement factor H-related 4, which we've looked into. So we see that patients who have high levels of CFHR4 have high risk of AMD if they carry particular genetic variants. So factor HR4 could potentially be a new target for treatment where we could inhibit factor HR4, and specifically in individuals carrying these genotypes that are associated with FHR4 levels. Other work that we're doing is on rare variants in the complement factor H and complement factor I genes. So we see that the carriers of particular genetic variants have lower levels of these complement regulators, and the idea would be that these patients could potentially be suitable for treatments with CFH or CFI supplementation. With CFH and CFI are main regulators of the complement system, and for example, using gene therapy, we could introduce the correct copy of that gene and in that way correct the genetic defect that these patients have.
What are your next steps in this line of research?
Yeah, so we're interested in looking at factors that can be measured in blood, so in plasma or in serum. So one is the complement system, so we've been doing quite a bit of work there, but we've also presented during this ARVO a large metabolomic study. So metabolites are compounds that can be measured in serum or plasma and that are for example, products from diet, but they can also be represent measures of our metabolism. And by looking into that, we've found that, for example, HDL, so high-density lipoproteins, give a higher risk for AMD, while the VLDLs, the very low-density lipoproteins, are actually associated with a decreased risk of AMD. We also see that energy metabolism is associated with AMD and, for example, amino acids. So that does point towards a role also for the diet in AMD. And yeah, with our research, we want to measure that in blood. So ideally, we would be able to monitor how patients are doing, and potentially we could advise them on diet or lifestyle habits by measuring these kind of components in blood.
How do you feel this kind of testing can translate into patient care?
So I think our work on these biomarkers, so these compounds that are measured in blood, could potentially help us to monitor disease status or disease risk. So if individuals are known to have a high genetic risk or a low genetic risk, we could look at what these biomarkers actually add to the genetics and other factors in predicting whether they would be at high risk of developing end stage or not. And most importantly, if we could advise people on a personal level what to do to actually inhibit their chance of reducing their chance of getting a late stage AMD.
Do you think that eventually this could be a routine blood test?
Yeah, exactly. That would be the idea. So within the IRIS consortium, that's a European consortium that I'm working in Europe, we're setting up a prediction website where people could order a genetic test. Next to that, we would like to also include the biomarkers, so things that could be measured in blood. And this could help us predict better what a person's risk is for AMD, and also, well, even more exciting, we would be able to measure or let people know what they could actually do to reduce their risk at a personal level.
Where can someone follow your research?
Yeah, so we have a website at a university, at the Radboud University Medical Center, where we give information on which clinical trials and which research studies people can participate.